The technique of doing the surgery is very interesting, and it can be done in several ways. The most common technique is to make an incision under the breast in the inframammary crease or just above the inframammary crease, cut down below the breast, and that's an important point. Implants don't go in the breast. They go either behind the breast and over the chest muscle, or they can go under the chest muscle, but they don't go in the breast. And so we make a pocket, and we have dissectors, so we dissect a space behind the breast, and then we take the implant and we can mush it up. These are meant to take wear and tear, or as I call it, manhandling. They're meant to take manhandling. And we mush it up and we put it in under the pocket. After we make sure the pocket is dry, there's no bleeding going on in there, we usually flush the pocket with an antibiotic solution first. We usually soak the implants in an antibiotic solution before we insert them, and then we put them in, and then sew up the tissue over it in multiple layers. With the armpit approach, which I use, we've had to develop certain special instruments. There are no scars on the chest at all, which is number one importance for a cosmetic procedure. But in addition to that, because it's a blunt dissection, I do no cutting. The only cutting I do in this operation is the skin incision. I do no cutting inside. Therefore, there's very little bleeding and very little bruising. When trying to find a plastic surgeon, whether it's me or any other plastic surgeon, they should check that he's a board-certified plastic surgeon. Only doctors who have gone through the plastic surgery residency programs, have taken the examinations, and passed them, can call themselves plastic surgeons. They can find out generally by asking the doctor if he's a real plastic surgeon, although some will lie, who aren't, and say they are, which is against the law, but they do it anyway. B, ask your family doctor. C, ask the doctor what hospital he has privileges at to practice plastic surgery, because many of the non-real plastic surgeons don't have any hospital privileges at all because they do all their surgery in their offices, which means if a patient has a complication, they can't take care of them. They have to dump them in an ambulance and send them to the emergency room, and it's adios. I mean, they never see that patient again. The recovery time after breast augmentation is pretty benign. It's easy. Most women will describe the discomfort post-operatively as what their breasts felt like when they were engorged with milk after they delivered their children. Of course, girls who haven't had any children don't know what that means, but it's a tight compression feeling because the skin and the breast tissue are not used to being stretched. And it takes 2 or 3 days for them to relax. First, they're going to want to fight back, but then they relax, and once they relax, the discomfort goes away.